It's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone, and welcome to yet another episode of You and Your Doctor, sponsored by All County Healthcare. You're able to listen to us on 96.9 and 95.3, and you're able to watch us on amp2.tv. I'm your host, Raymond Phillips, and today we have a very special guest with us today, Ms. Jarynet Beltran, who's an APRN at Primary Care Specialist of South Florida. Nice to meet you, Ms. Beltran. How are you doing today?
Good. Thank you, Rima. Thank you for having me on.
Of course. We are very, very happy to have you on our show tonight.
Thank you.
So, for anyone who is watching us tonight, Primary Care Specialists of South Florida, they have two locations located at 20200 West Dixie Highway, Suites 1108, Alventura, Florida 33180. And their second address is located at 201 Northwest 822 N Street Avenue, Suite 201, Plantation, Florida 33324. And so Ms. Beltran is here tonight to talk to us about how our health is just overall connected, and how things like your physical health, your mental health, as well as your spiritual health that a lot of people view as separate actually plays in together as a whole.
Yes. And so what I really believe, and I tell my patients all the time after working for many years in the hospital, is that you know, you really have to take care of your mind, body, and spirit, right? Mm-hmm. So I feel like everything is aligned. For so many years working in the hospital, you have where you consult a nephrologist or a cardiologist, and cardiologists just look at the heart, or the nephrologist looks at the kidneys, and they prescribe certain medications, but they don't take into account how it's going to affect the rest of the body. And I think as a primary, you look at the patient as a whole, and you understand that there are certain things that affect, and you kind of take all those things into consideration, and primary is the head of the patient's care.
That's very interesting for sure. So can you talk to us a little bit about how the increased level of hormones in our food has led to imbalances within our lifestyle, especially kids that are getting younger and younger?
So I think that our culture has really gone to bigger is better. And most and oftentimes when you look at an organic, let's say lemon, and you look at a Publix lemon, all of a sudden a lemon that is a lemon compared to a Publix lemon is literally looks like an orange. So when we look at how nature takes its course, and how we're actually are enhancing other foods, this is actually having an effect on all of us, not only our children but ourselves. We're not eating not only foods, but we're eating things that are now being infused with either steroids or other chemicals to make things bigger or grow faster, like chickens, and we don't have enough. So bigger is not better. There's a lot of foods that are causing a lot of inflammation within the body that's leading to a lot of chronic diseases and a lot of chronic fatigue that we're unaware of.
Do you mind, for our listeners and viewers watching tonight, going into a little bit more detail about some of those foods that will lead to inflammation?
So more than oftentimes, it really depends on the individual. I think that a lot of the foods that are causing inflammation are things such as milk, cheeses. A lot of people are really lactose intolerant. A lot of people are eating processed foods, which have a lot of chemicals, which also cause inflammation. In causing inflammation, it causes the lining of the stomach to be chronically inflamed, which happens to not allow your stomach to absorb certain nutrients that you need. That's why we're seeing a lot of chronic fatigue in a lot of patients, because they're not able to absorb, for instance, B12, because our microgut and, it's like our second stomach needs to be in balance so that we can, absorb those nutrients. So it's causing a lot of different health issues that we may or may not be aware of, but we need to, definitely kind of stay focused on what we're putting into our bodies.
Oh, absolutely. I definitely agree with you. This is a world where we put anything and everything into our mouths without actually understanding how the foods that we eat actually impact our overall health and well-being. And it's just so important to be able to understand what foods you need to, what foods you're able to eat, what foods you're not able to eat in order to keep your hormones and keep your whole body balanced overall. So going into more about your practice, what are some things that you do for your patients specifically to help them overcome some of these chronic diseases?
So I think it's really having an understanding of our relationship with food. Over the course of the years, we're already kind of programmed or pre-programmed to make sure that we eat all of our foods. We've gotten into trouble as kids, and so there's a lot of childhood trauma or things that have occurred that a lot of us don't understand or don't revisit, but we're kind of programmed to eat everything that's on the plate for a lot of our cultures, not really understanding that portion control is big. So understanding your relationship with food is big. More than oftentimes, if you're happy, you eat. If you're sad, you eat. If you're bored, you eat. If you're anxious, you eat. And everything is really around food. So knowing and understanding your relationship with food I think is very important. If you are back in front of the refrigerator after you ate dinner, you really need to stop yourself and ask yourself, are you hungry? And more than often time, you're not hungry. You are either trying to mask something, and it's really getting down to what is the issue? What is the problem? What are you feeling that's making you either unhappy, or what are you trying to forget about? So it's a lot of digging to find out what's really going on, so that you're not using food as a drug, essentially to mask something that you're feeling or that you don't want to feel.
Absolutely. Both of my parents are physicians, and one thing that my mom always told me is that sugar is the #1 drug in the United States of America. It is one of the #1 most addicting substances, and we're putting it in every single thing that we eat. But yet it does such harm to our bodies as a whole.
And I agree with you. I have a 3-year-old son, and I have a niece as well, and it's really interesting and kind of a little heart-wrenching to see at the same time when you feed them a cupcake, how kind of instantly their behavior changes and they actually get not only hyper but actually more aggressive than they normally are.
Interesting.
So when you're looking from the outside in and you see that from like the health care standpoint, that is a little concerning. That's concerning.
No,
So
absolutely. I definitely agree with you. And I know we talked about it earlier, but how women And honestly, children are going through puberty at an earlier and earlier age, and that is directly impacted by what we're giving to them growing up as children.
And I agree. A lot of things that we're using, such as milk and other ingredients that hormones to make our food bigger, because we have the concept that bigger is better, is really affecting our children. And I feel that that's why we look at some children growing up and they're 11, but they look like they're 15 or 16. But at the same time, the men at about 27, 30, sometimes even 32, their testosterone is dropping. So their testosterone is actually at abnormal levels, which is absolutely concerning because it puts them at risk for a lot of different things.
Absolutely, definitely. So I guess more so generally speaking, I know you mentioned portion sizes being too big, just as nationwide standards. What do you do for your patients who are struggling with that portion control?
So I use a plate that's kind of used when you're feeding toddlers in the beginning. I tell them not to use spoonfuls that culturally we know, worldwide, it's kind of a whole spoon, but it doesn't really give you the actual size. So using a cup of, to serve yourself, like whatever it is, if it's rice or whatnot. And actually, we take pictures of everything. So food journaling is a big thing. So actually journaling what you eat, the pictures of what you're eating, and actually what you're feeling during what you're eating. Sometimes there's foods that we crave and it's not necessarily the right foods. It's just more so because our adrenal glands are secreting stress hormones. And so when you are in a feeling stressful, sometimes you do feel like eating a cheeseburger or things that may not be the healthiest.
We'll make it better and relieve some of those feelings of stress and anxiety. So I know that we talked about a little bit about the negative emotion that goes along with food, but what about the positive ones? Because I don't know if you're anything like me, after a big event, you always want to celebrate at a restaurant. It's always the very first thing that you go to. So celebrating with that food, would you say that there's also somewhat of a negative relationship with celebration and correlating that with let's go eat?
I think there is a correlation with any kind of emotion in food. I tell my patients everything in moderation is key. As long as, I'm not saying don't ever eat anything, but, every once in a while, as long as it's within once a month, every 2, weeks or whatever, it's okay. Everything in moderation is fine. I think that once we take it to the next level and it's an everyday habit, that's where it becomes a problem.
Absolutely. One thing that I deal with a lot with my clients are people who don't have or are not making the time to cook the food at home and end up having to go and eat out. And again, one of the biggest things, even when they do eat the quote unquote healthy meals, the portions are enough for 3-4 people, and it's going into one person's body. So you still have the over portions, especially when you go out to a lot of these restaurants down here.
So what I tell my patients a lot, I say, well, all of us don't have time to cook, including myself. But one of the easiest things to do is putting things in the oven. So I tell them, hey, you can take aluminum foil, take a piece of chicken breast, put your favorite veggies, put olive oil on it, wrap it up. Take another piece of salmon, put your favorite veggies on it, wrap it up. So you can do a bunch of different kind of meals, wrap it up, and in 30 minutes you have a meal. So that way when you come home and you're actually really hungry, because most people don't get to eat throughout the day. Some people think that not eating throughout the day and only eating one meal is going to help them lose weight, when in reality it actually slows your metabolism down. But at least when you get home, you have a home-cooked meal, and it's actually portion controlled, something that you can reheat and eat.
Absolutely. And that is such a perfect segue into my next question for you, because I see so many people every single day who say they don't eat breakfast. They may have like a snack or two for lunch, and then they have a big meal at the end of the day. So I know you deal with this probably all the time. So what is advice that you can give to people who think that if they just have one big meal at the end of the day, that will help them with their weight loss journey?
So what I tell them is, usually a lot of us don't like breakfast, and we're kind of in a time crunch. So the best thing is maybe a smoothie, or what I like is oatmeal in the blender with some almond milk. You can put some protein powder, some ice, some cinnamon, and just take it to go. You can juice. You can do a protein bar, but it's very important to make sure, like they said, breakfast is very, like, the most important, and a lot of us just drink coffee and keep it moving. Yeah. But it's very important to make sure that your body is getting, at good intervals, meals throughout the day.
Absolutely. And speaking of coffee, I know it's a lot of people. I know I love coffee. I have it every single morning too, when I'm going through my morning routine. But would you say that coffee aids in the, I guess, appetite suppressor, especially in the morning when people are going throughout their day?
100%. Coffee is an appetite suppressant, and it does suppress your appetite. So that's why maybe perhaps eating or drinking whatever it is that you need to do first, and then drinking your coffee may help.
Absolutely, absolutely. Well, this is such exciting information. And so I know we talked a lot about the over portions and everything on that side of the spectrum, but can you tell us a little bit about the overall under eating of especially a lot of the nutritional foods as a country as a whole?
So it's very unfortunate, but a lot of our foods are empty calories. And the fact that we're eating empty calories means we're eating more. However, we're nutrient deficient. And we're nutrient deficient because the foods that we're eating are pretty empty in the nutrients that we need. So it's very important to make sure that you learn how to read a nutritional label. I think a lot of us don't know how to read nutritional labels. I think a lot of us don't even take the time to turn the product around to actually see what's in your label, because there shouldn't be more than 1 or 2 lines if that's the product that you're trying to buy. If it has 5 lines or 6 lines or things that you can't pronounce, it's probably something that you really shouldn't buy. So it's just really educating yourself, and we have Google and we have things at our fingertips that we can use, and I think it's important that we use it so that we're not eating the empty calories and we're actually, providing nutrients to our bodies.
Absolutely. I definitely agree with you on that 100%. So we are going to head and take a quick commercial break, and I will see everyone when we get back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, everyone, to You and Your Doctor, sponsored by All County Healthcare. We are here with Jarynet Beltran, who is the owner of Primary Care Specialists of South Florida. You're able to reach the office at 786-275-3725. And they actually have 2 locations. The first one located at 20200 West Dixie Highway, Suite 1108, Aventura, Florida 33180. And their second location is located at 201 Southwest 82nd Avenue, Suite 201, Plantation, Florida 33324. And if you have any questions, you're able to go on to their website at www.letuscareforyou.com. So welcome back, Miss Beltran. How are you doing today again?
Good. How are you?
Yeah, we're doing good. We're doing good.
great.
So I feel like this would be a great segment to go into some of the opportunities that patients were able to receive at your clinic.
So we do a lot of different things. We try to manage as much as possible because we know that primary is the head and kind of cares for everything. And so we do allergy testing. A lot of people don't know what they're allergic to. And again, chronic inflammation causes chronic diseases because your body is always reacting to something. So it's very, it's a kind of a unique thing to see how many people are allergic to simple things as rice. Rice is big in our culture and how it really affects the body. We do weight loss, we do hormone replacement, we have our own pharmacy in-house, and we're holistic, in other words. It's sometimes sad to say that most providers don't take insurances, for holistic care, but we use a lot of alternative medicine where it needs to be, and a lot of patient education in terms of if they want to lower let's say their hemoglobin A1C, we use a lot of like cinnamon with alpha lipoic acid, or their cholesterol. We educate the patient because we know that if we empower the patient with the knowledge that they need, they will do good. They will do better. And we've seen it. We've seen it with their labs. We have definitely seen it. They're so excited to just come back and say that they've lost weight, or excited to come back and see their hemoglobin A1C. And I think that's probably one of the most, rewarding things is that they're just so excited to come back. And most people are scared to go to their doctors or whatnot, but these patients are just so excited because it's like we create a program together. And I think that that's the way it should be.
That's so amazing, because I know for so many patients nowadays, it's so hard to get enough time with your primary care physician for them to actually be able to hear and listen to what you're saying, and for you and your patients to collectively create a plan together for them to reach their goals. I can't imagine how rewarding that is for both the patient and for yourself as well.
It really is, and I think it's very important. If you want to create change, you have to make sure that your patient feels and knows that they're important and they're part of the family. And I think that that's what separates us from other primary cares, is that they're family. And so they bring their mom, their dad, their brother, their uncle, their neighbor, because they want the same kind of treatment. They don't want to be a number, they want to be part of a family. And that's what we have, it's a family.
I also heard that you do home health care as well.
So we do home health care. We try to make sure that we cater to patients, especially our Medicare population that can't come to us. We go to them. My experience way back when was in home health. So I try to make sure that if they're not able to, which is most patients that may come out of the hospital or that are homebound, or it's too difficult for them to come to us, for us to go to them, because they also deserve, the proper healthcare. We do everything from EKGs to lab work at their home.
Wow, that's super big. I know it's probably more comfortable from the patient's perspective as well, being able to have these services provided to them in the comfort of their own homes.
They do. They love it, and it's kind of bringing back the old school type of medicine, when the doctors used to come by with their little black bags, probably before our times, but
yeah, I was gonna say I don't remember that one.
Before our times, but the patients really, that's what they like compare me with, so that time, and I think it's important. I think that everybody deserves good health care, and so that's what we're just trying to spread is the good all over health care with caring services,
And it's so crazy that a lot of it just comes down to listening and having that proper communication. But with, I see a lot of primary care offices where one doctor will have like 30 patients within that day, and they just don't have the time to be able to sit down and really talk to their patients the way that they need to.
And I think that's the way that healthcare, unfortunately, has turned, where the patients don't get the ability to speak their mind or ask the questions, so they leave doubting a lot of things. And therefore, I have, not only within my own practice, but also in the hospital, made it a project and said, well, can you have numbers and can you also have good health care? And I was able to meet the quota in terms of numbers for the hospital.
Wow.
And also have that good health care in the hospital. And I know that it's like, okay, well, if I can do it in the hospital, I can do it outside of the hospital.
Absolutely.
And that has been my mission and my goal, to make sure that you listen to your patients.
Absolutely. So for some of our physicians who are out there, do you have any tips and tricks in how you're able to go about managing so many patients' needs, but also giving them the best possible care at the same time?
I think it's just asking the right questions. And sometimes, from my experience, I worked at JFK ER, and when you're in a life and death situation, you have to ask like the very pertinent questions to get what you need, because you can get what you need and make sure that your patient feels like they're being heard. I think that's very important. And in the end, just always ask, do you have any questions? Do you understand? So that's very important.
No, absolutely, because I don't like seeing people go out the day not having their questions answered. So the fact that there's people like you who are able to sit down and really give these patients the best care possible. And again, for our listeners and viewers watching, Ms. Beltran's office is primary care specialist of South Florida, and you're able to reach them at 786-275-3725. That is it for our show today. And again, I am your host, Raymond Phillips, and please feel free to join us next week, Monday, 6:30, for another episode of You and Your Doctor.
Thank you for